Okay, continuing. Because of the radioactive properties of nuclear medicine, there needs to be safety precautions taken. All the new radionuclides are radioactive and they are going to continuously emit radiation. It's unlike diagnostic X-ray because diagnostic X-ray, one time radiation is being emitted is when you shoot the X-ray, which is from milliseconds to a few seconds at a time. So it's very you can control how long the radiation is being emitted. Well, nuclear medicine, you're handling radioactive materials, so it's always emitting. You can't turn it off. It's always emitting it. So there needs to be safety measures taken. In general, the quantities do not present any significant damage, but care or any significant hazard, but care still must be taken to reduce unnecessary exposure, because you don't want to be exposed to this over long periods of time if you don't have to be. And who knows the long-term effects of any of this. Designated preparation areas need to, such as isolated ventilation, protective lead and glass shielding for the vials and syringes being used in the studies. Absorbent material and gloves must always be available. The handling and administering of diagnostic doses to the patients warrants the use of gloves and a lead syringe shield. So you need to be protecting the patient and yourself. All of this reduces exposure to the hands and fingers during patient injection. Radioactive materials that come in contact with the skin can be absorbed, and sometimes they are not easily to wash off, so you need to be wearing gloves at all times. Also, the people around this, in and around it, the techs and the pharmacists, need to be wearing the appropriate monitoring devices, such as your film badges and the TLD rings. That would be for your fingers and hands. And again, ALARA is going to apply to this, as low as reasonably achievable. Applies to all nuclear medicine personnel. The instruments used in nuclear medicine. Basically, the modern day gamma camera. That's what's used. That's what collects the gamma rays, converts it to electronic signals, and then produces it on screen. You hear the word scintillate. That means to emit light photons. The scintillation detector is very sensitive. Radiation is very sensitive. It's used to detect ionizing radiation by observing the emission of light photons induced in a material. It's evolved into the gamma cameras of today, and those detect the gamma rays that are produced in nuclear medicine. They'll have in the gamma camera they'll have a collimator. It's located at the face of the camera where the photons enter the camera. It's just like in diagnostic X-ray. It's used to separate the gamma rays and keep scatter rays from entering the scintillation crystals. So it keeps out the unwanted stuff and takes in just the useful stuff for as much as it can. It's made of material with a high atomic number, such as lead. That's going to absorb these scattered gamma rays. Can't penetrate through that. So that's basically what it's doing. Different collimators are used for different types of examinations. It just depends on the photon energy used and the desired level of sensitivity and resolution. You'll hear about a crystal and a light pipe. The cameras, there's crystals inside the cameras. They're made of sodium iodide with trace quantities of thallium, and that thallium increases light production. It's effective for stopping most gamma rays used in nuclear medicine. The thickness is 1/4 inch to 1/2 inch. The thicker, it's better for radiopharmaceuticals with higher energies, above 180 keV, but the thicker it is, that means you're going to have a lower resolution. It's inversely proportional. A light pipe may be attached to the crystals, or it may be used to attach the crystals to the photomultiplier tubes. Light pipe, what it is, it's a disc of optically transparent material that helps detect photons from the crystals into the photomultiplier tubes. Detector electronics. There is going to be an array of PM photomultiplier tubes that's attached to the back of the crystal or the light pipe. Anywhere from 80 to 100 are used per camera. They're used to detect and convert light photons emitted from the crystals into an electric signal that amplifies the original photon signal. That electric signal, once it's been processed, it's transmitted to a display system, and that's what you see. That's what you see, and that's what you record. There can be multiple multi-head gamma cameras. Usually, anywhere from 1 to 3 are used. The dual head or the 2-head camera systems, they're going to allow both anterior and posterior imaging, which is nice. You can do both at the same time. They're used for whole body bone and tumor imaging. In the triple head systems, they're going to be mainly used for brain and heart studies, and these are usually suited for the SPECT systems. Computers in nuclear medicine, they're going to, well, they're definitely used in nuclear medicine. They're used for a wide range of things, and this is what they are. Basically, they're going to acquire and process data over a specific time frame, or to a specific number of counts. You can keep records with computers. They're needed for the NRC, the Nuclear Regulatory Commission, and the FDA for quality control, and for the hospital records and patient records. They allow radioactive doses and dose volumes to be calculated much more quickly than you could by hand, so they speed up the process. And you can use them to schedule patients. You can get special software with the computers that allow them to collect, process, and analyze functional data, or the functional info for quantitative analysis. There's 5 main imaging methods: your static, your whole body, the dynamic SPECT, and then the combination of SPECT and CT. And I'll go over those here briefly. The SPECT imaging, it's a single image of a particular structure. It's a snapshot of that structure. A snapshot of the radiopharmaceutical distribution within that part of the body. So it shows what that radiopharmaceutical is doing in that particular location in the body. You can do anterior, posterior, oblique. Pretty much all aspects of that structure can be imaged with these snapshots. Low radiopharmaceutical activity levels are used to minimize the radiation exposure to the patient, and these can take anywhere from 30 seconds up to 5 minutes. Whole body imaging uses a specifically designed moving detector system to produce an image of the entire body, so the whole body is scanned. You can see it all at once. It's for whole body bone scans. Whole body tumor and abscess imaging is also done this way. Dynamic imaging, what that is, it's a display. It displays the distribution of a particular radiopharmaceutical over a specific period. It's a flow study, so it's time-based. To evaluate blood, you can use it to evaluate blood perfusion into a tissue. These can take anywhere from 1/10 of a second to over 10 minutes just for one image. Your SPECT imaging, it's very similar to the images of CT and MRI, where you have slices. 1 to 3 gamma cameras are going to be used to produce the tomographic images, and it's mainly used for cardiac perfusion, brain, liver, tumor, and bone studies. And then your combination, it's a combination of SPECT and CT imaging. It merges the two. Use the functional imaging of SPECT with the anatomical landmarks of CT. It's a very powerful diagnostic tool. Lots of information can be pulled from this. By merging the two, they found that it can change the course of treatment for a patient by anywhere from 25 to 30%. So that makes a huge difference in more effective treatment to patients that will be able to use this.